Hey everyone, it is Kevin Henry, the editor-in-chief for Dr. Bicuspid. Welcome to the Dr. Bicuspid podcast. Honored to be joined today by Dr. Leigh Colby. Dr. Colby, how are you today?
Doing great. Good to see you again.
Good to see you as well. So glad that you and I crossed paths at the AAID meeting in Las Vegas, where you were telling me a little bit more about TriAgenics. You were telling me a little bit more about what is going to be coming for third molars next year, which I'm really excited about that. But before we dive into all of that, I just want people to know a little bit more about you. So do you mind giving us a quick bio?
Sure. I graduated from the University of Minnesota School of Dentistry in 1980, and I've been involved with two high-tech startup companies while practicing part-time. So I started TriAgenics in 2016, and this is my third venture. Pretty exciting.
Well, it is. I was just going to say, I'm excited about this. And I will tell you, a lot of our readers were really excited to read. We published about TriAgenics. It was a must-know dental technique for 2024. We are going to link to that article in the show notes where we're talking about ablation and third molars. But, I want to make sure we had Dr. Colby on because we had some questions come in about the technique. And I thought, why not go straight to the source to ask these questions? So, Dr. Colby, I'm just going to ask you right off the bat. We talked about this being a 2024 must-know technique. When do you expect FDA approval for this?
Our mission is to get the 510K application submitted in February of 2024. We expect FDA clearance by mid-2024, and we'd be on the market shortly thereafter.
And this is a real game changer, and it's one of the things that I was most excited about whenever you showed it to me. I think that it is something that is not only going to help dental praxis but also patients as well, obviously. But we had one question come in about, is the treatment process similar to using a laser to ablate the soft tissue?
Yes and no. It's similar in the sense that it's a thermal treatment, but after that, they're totally different. Lasers are very focused. They are high temperature, and it's difficult to get volumes. We use microwave ablation, which has never been used in the dental industry, but it's commonly used for tumors because they can get large volumes of ablation. And that's what we need for fully guided third molar tooth bud ablation.
And as we discussed, this is really something that's going to change how things are done whenever it comes to third molars, I believe. What's the biggest feedback that you're getting about it whenever it comes to maybe pushback or questions? What are the biggest things that you're hearing whenever it comes to that?
Well, the guys that get the most excited about this are the periodontists. And the reason for that is they deal with the damage that third molars cause. I know when I was practicing full time, whenever I had third molar involvement with damage on the distal second molar, it was an automatic referral. And almost always the patients would come back and the periodontist could do very little to undo the damage. So it's eliminating all this damage that occurs.
And is this, I've never worked in a dental practice, but you taught me pretty quickly that this would work. Do you see this process as complicated in any way, or is there any kind of learning curve that you think there will be with this?
Well, when we met in Las Vegas, I showed you how to do the procedure in less than 1 minute. So it's pretty straightforward. But for any dentist that places implants, they're already trained. The process, can I show you again? The process is real straightforward. We provide a surgical guide, it's a modified dental implant surgical guide. And when you seat it on the patient's teeth, it's got a 2-millimeter guide. And we provide a disposable microwave ablation handpiece. And you press it into the sleeve of the surgical guide until it completely stops. It puts the center of ablation for this handpiece, the ablation handpiece, right in the center of the tooth bud. The dentist steps on a pedal, and the ablation countdown occurs, and then you remove the handpiece and the guide, and you're done. It's really that simple.
It sounds very simple. It looks very simple, which I think is one of the reasons why we had so much good feedback about it at drbicuspid.com when we were talking about this being a must-know dental technique for 2024. So I'm just going to ask you to put a crystal ball and your psychic hat on here, like Karnak back
Yes.
in the day that you and I might remember. So if we're talking a year from now, at the end of 2024, what will you have hoped happened with TriAgenics and this procedure?
We hope to be in thousands of dental offices by the end of 2024. And the reason why this will be in so many offices is because it's better treatment. I mean, that is the bottom line. It's better treatment for the patient. And the reason for being better treatment, we believe it's going to eliminate all the complications associated with third molar removal.
You know, standard of care is something it's a high bar, obviously. But you and I talked that this could be the standard of care. This could evolve into that whenever it comes to third molars. Is that correct?
Yeah, we believe it'll be the standard of care by 2030. And again, the reason for that, no complications, better clinical outcomes, no damage to the tissue distal to the second molars. And that's really what this is all about, eliminating the complications.
And as I shared with you in Las Vegas, my daughter went through a horrible issue with dry socket after her third molars were taken out. So this is something where I'm just like, this would be nice if nobody had to go through something like that again, and this could go steps toward eliminating things like that.
Yeah, the average third molar extraction patient misses 3 days of either work or school, and the parents have to adjust for that if they're having their teenagers treated. So it's really debilitating. I learned the hard way. I had mine out my second year of dental school. It was not the way I thought I would learn about dry socket. So I'm very empathetic with third molar extraction patients.
Well, Dr. Colby, I know there's so much that we could get into, but I want to make sure that we're going to point people toward the article so that they make sure they understand what this is. They already see the questions that you and I have gone through on drbicuspid.com. But I also want to make sure how are people, what's a way that they can learn more about it or ask more questions if they want to dive a little deeper?
Well, there's two ways. They can either email me directly. That's Leigh, Leigh Colby, Colby, at TriAgenics.com, or they can go to our website and use the contact us function.
That's great. And we'll make sure to link the TriAgenics website in the show notes for this podcast. So obviously, it will hopefully just be a click and you can learn more, as well as, again, see the article on drbicuspid.com. Dr. Colby, thanks so much. Always good to catch up with you, my friend.
Kevin, great spending time with you. Take care.
And thanks to all of you for listening to this episode. We really appreciate it. And we will be back soon with more great information that'll help your dental practice grow in 2024 here on the Dr. Bicuspid podcast.